What issues does a hysteroscopy typically reveal? Imagine peering inside the uterus with a tiny camera to uncover hidden issues that might be affecting fertility or pregnancy. That's what a hysteroscopy does. It's a minimally invasive procedure that allows doctors to see directly into the uterine cavity. This is especially helpful when fertility problems seem unexplained or when there's suspicion that uterine factors might be involved. One common issue found during hysteroscopy is endometrial polyps. These are small overgrowths of the lining inside the uterus. They can block the embryo from implanting properly or cause early pregnancy loss. Luckily, they can often be removed during the same procedure, which can improve chances of conception. Another issue is submucosal fibroids. These benign tumors grow inside the uterine cavity and can distort the shape of the uterus. They may block the fallopian tubes or interfere with embryo implantation. Removing these fibroids through hysteroscopy can help restore the normal shape of the uterus and increase the likelihood of pregnancy, especially for women using assisted reproductive technologies. Hysteroscopy can also identify intrauterine adhesions, sometimes called Asherman's syndrome. These are scar tissues that form inside the uterus, often after surgery or infection. They can prevent the uterine lining from developing properly, making implantation difficult and increasing miscarriage risk. During hysteroscopy, doctors can cut or remove these adhesions, helping to restore a healthy uterine environment. Uterine septum and other congenital abnormalities are also detectable. A uterine septum is a fibrous or muscular partition dividing the uterine cavity, which can be linked to infertility and recurrent pregnancy loss. Hysteroscopy allows for diagnosis and surgical correction, known as septum resection, which has been shown to improve live birth rates. Chronic endometriosis, or long-term inflammation of the uterine lining, is another condition that hysteroscopy can help diagnose. It's often caused by infection and may not show up on other imaging tests. Identifying and treating this inflammation can improve the chances of successful implantation and pregnancy. Hysteroscopy can also reveal other structural abnormalities like retained products of conception, unusual uterine shapes, or polyps that might be contributing to fertility issues or pregnancy loss. In fertility treatment, hysteroscopy is not just diagnostic. It often allows for immediate treatment, such as removing polyps, fibroids, or adhesions, or correcting septa. This combined approach can significantly improve the chances of pregnancy and live birth, especially in women with unexplained infertility or those who have had failed assisted reproductive procedures. While hysteroscopy mainly examines the inside of the uterus, it can also provide clues about issues related to endometriosis, which affects the pelvic organs. Although it doesn't directly visualize endometriosis lesions outside the uterus, it can help identify uterine factors that might complicate fertility in women with this condition. Overall, hysteroscopy is a powerful tool in fertility care. It helps reveal and treat uterine abnormalities that could hinder implantation or cause pregnancy loss. By addressing these issues, it creates a more welcoming environment for conception and pregnancy. Remember, each person's situation is unique, so it's essential to consult with a healthcare professional for personalized advice and treatment options.